We just wanted to take a moment to say we see you. You're a fan of Tradeoffs, and we appreciate that. And a really great way for fans such as yourself to help this nonprofit newsroom is by taking our audience survey. Your feedback really is critical to all that we do here. It helps us evaluate our performance, understand how we can serve you better, and it helps us measure the impact of our reporting. Your insights are invaluable to our organization. So please, go to tradeoffs.org now to take our survey. It should only take you a couple of minutes to complete. And thanks for your help.
Learning that you have dementia is devastating and scary, both for the patients and the family or friends who become caregivers. Spouses or adult children have to grapple with managing a loved one's money, medications, hygiene, taking over their lives, keeping them safe.
I absolutely adored my mother. I would have carried her on my back if I had to. And it was still the hardest thing I've ever done.
For the first time ever, Medicare is acknowledging the heavy burden that falls on the more than 11 million caregivers by funding services to support them. Today, the bet that caring for caregivers will also help the patients and slow down spending. From the studio at the Leonard Davis Institute at the University of Pennsylvania, I'm Dan Gorenstein. This is Tradeoffs. Rosanne Corcoran's mom, Rose, worked as a hairstylist and also ballroom danced every weekend into her 80s.
She would work 3 days a week, and then she would dance Friday night, Saturday, and Sunday.
Rose was charming and social. But as the dementia got worse, Rosanne says her mother struggled to remember to eat dinner, pay her bills, take her blood pressure medicine. Standing all day at the salon got too hard. She retired. She stopped dancing. Rosanne, 47 at the time, decided her mom needed to move in with her after she had fainted in the summer of 2015.
To scoop her up and bring her back to my house and say, "Mom, you can't go home again," is heartbreaking because I'm taking something away from her. I'm not. The disease is. But it sure does feel like I am.
Rosanne's husband traveled a lot for work, and her siblings were unable to help much. So Rosanne quit her job as a real estate agent and became her mom's full-time caregiver. That meant getting her to the doctor, helping her bathe and dress, all on top of raising 2 kids. Every day, fresh chaos.
It's the complete and utter overwhelming feeling of never being on top of it, of never knowing enough and not thinking that you know enough.
Rose would go days without sleep. That's common with dementia, which meant Rosanne was up all night too. In November of 2020, after 4 sleepless nights, mother and daughter were both spent. Every half hour, Rose was calling out, "I want to go home." Rosanne tried to distract her. Didn't work. She told her mom that she was safe. Didn't work. Afraid her mom would bolt for the door, Rosanne, desperate, called an Alzheimer's helpline at 2 a.m. The call taker repeated all of the tips Rosanne had just tried, validating her mom's feelings, distracting her, pat advice that made Rosanne feel that much more isolated.
After I was put on hold, it was almost like they were reading off the sheet of what to do when someone asks to go home. It's not helpful.
Rosanne is just one of 11 million family members and friends who provide the vast majority of hands-on care for nearly 7 million Americans living with Alzheimer's disease and other dementias. All that unpaid work totals 18 billion hours a year, according to the Alzheimer's Association. And yet, even with all that, people with dementia still cost Medicare almost 3 times as much as other patients. They are more likely than others their age to end up in the hospital after taking the wrong medicine, refusing to eat, wandering into traffic, or falling at night.
I can tell you every caregiver is drowning for more help. They need more help. They need more support.
For Rosanne, the moment has passed. She struggled with caring for her mom for 6 years in her home until Rosa's death in 2021 at age 92. But for other Americans, at least some relief is finally on the way. This summer, Medicare is launching an 8-year pilot study with a groundbreaking plan. The government will pay for programs that support the caregivers of people living with dementia. Caregivers like Rosanne.
It is a big effing deal, frankly.
Liz Fowler directs the Center for Medicare and Medicaid Innovation, which is leading this project. It's called Guiding an Improved Dementia Experience, or GUIDE. Medicare is placing a bet that investing in caregivers like Rosanne will pay off by helping keep patients with dementia healthier and happier without exhausting them emotionally and financially.
It has the potential to improve the quality of life for those living with dementia and alleviate the significant strain on their loved ones while helping people remain in their communities. We've never tried anything like this before.
Here's how the program will work. Each family member will get a care coordinator, sort of a coach, who's trained in dementia care. They know the patient, the caregiver, and can troubleshoot. Exactly the kind of person Rosanne wishes she could have called at 2 a.m. that terrible night back in the fall of 2020. And this coach or other member of the care team will be available 24/7. Coaches will also help with doctor's visits and help identify adult daycare or in-home aides. Liz says Medicare will cover $2,500 a year of those daycare costs for patients with moderate or severe dementia, enough to pay for a few hours a week.
It is really addressing this critical role that caregivers play in the lives and outcomes for people living with dementia.
This is the first time Medicare has paid for a whole package of support specifically aimed at caregivers. The program is based on the success of programs up and running at a handful of hospitals. UCLA, UC San Francisco, Emory, Johns Hopkins. All have been experimenting with something like this for years with promising results.
The magic comes from the care coordinator who work with the patient outside the office.
That's Dr. Malaz Boustani, a geriatrician at Indiana University. He helped pioneer this approach in the early 2000s.
The care coordinators work with them in the home, in the community, with the caregiver.
Each study was a little different, but overall, the evidence found that patients in these programs had fewer emergency room visits, fewer symptoms of dementia, and were able to continue living longer at home. And for the caregivers, they reported lower levels of stress. After the break, what it's like to be enrolled in one of these programs and why they seem to be working so well.
Hey, Dave.
Yeah, Randy.
Since we founded Bombas, we've always said our socks, underwear, and T-shirts are super soft. Any new ideas?
Maybe sublimely soft.
Or disgustingly cozy.
Wait, what?
I got it. Bombas. Absurdly comfortable essentials for yourself
and for those facing homelessness.
Because one purchased equals one donated.
Wow, did we just write an ad?
Yes.
Bombas. Big comfort for everyone. Go to bombas.com/ACAST and use code ACAST for 20% off your first purchase.
Welcome back. Before the break, we heard about Medicare's big bet that helping caregivers will pay off. Tradeoffs reporter-producer Alex Olgin has been talking to physicians and care coordinators at these university-based programs. So, Alex, what's the secret sauce, right? How are these programs lowering caregiver stress, improving patients' lives, and keeping them at home?
Yeah, it all sounds pretty good, doesn't it? So, Dan, as we heard from the doctor at the Indiana hospital, Malaz, just a few minutes ago, he called these care coordinators the, quote, magic of the model. And that really stuck with me. They're specially trained in how to care for dementia patients. And they spend lots of time getting to know the caregivers and the situation, both over the phone or in person. Basically, they're building trust. They're really in the trenches with these folks.
It sounds like a caregiver for the caregiver. And how is this actually helping patients with a progressive brain disease?
So Malaz explained it to me this way. Regardless of the program, patients with dementia are on a long, slow decline. What the program does do is help manage other symptoms that come along with dementia, like agitation, depression, and sleep disturbances. If you can ease those symptoms, you're improving the quality of life for the patient, and you're probably making things a lot better for the caregiver, too.
Yeah, that makes sense. I mean, my grandmother had Alzheimer's, and it was really hard for her and our whole family. Brutal, actually. So what exactly are the care coordinators doing?
It's a real mix of things, Dan. I talked to Lauren Sullivan. She does this job at Eskenazi Health. That's the hospital in Indianapolis where Malaz pioneered this approach to dementia care. And she walked me through a few standard ways where she helps families. First, she says she's almost introducing the person with dementia to the caregiver.
The hardest thing, I think, for a lot of people that have a loved one with dementia is they see the changes in that person, and they're not the same person that they knew and loved. And that's the hardest thing. And in the beginning, that's kind of what we're working through, is working through that grieving process, coming to terms with what is now and how to deal with that person.
Second, Lauren likes to teach caregivers how to talk to their loved one, how to help keep them engaged with activities like puzzles or games. For one patient who was a bit obsessive, she suggested that the caregiver get them to try paint by numbers, and it worked. And then third, she's like a healthcare system navigator. She helps caregivers figure out if patients should go to the hospital or maybe their primary care doctor. She goes with them to regular appointments at the clinic and helps them manage their medications.
Alex, what you're describing is clearly hand-holding practical support for caregivers and patients. I can see why these studies found that this lowered caregiver stress.
Yeah, and here's a story that really puts a fine point on that, Dan. Lauren introduced me to one of the caregivers that she works with, a woman named Cindi Hart. Cindi cares for her 80-year-old mom who has dementia and is also a retired nurse. That means she was really reluctant to give up control over her own medicine. One day, Cindi headed over to her mom's, and she saw pills scattered all over the floor.
She is walking through her apartment with the pills falling out of her hands, and I'm looking, seeing the pills all over the place. And she said, "Oh no, I take them. I was a nurse. I know what I'm doing."
Cindi tried to appeal to her mom's sense of reason. It didn't work.
She was uncharacteristically belligerent and irate to the point where she was screaming and her eyes were bulging.
The arguing was going nowhere. After Cindi left her mom's place, she called Lauren. Lauren said, "Stop trying to reason with her." As hard as it was, Cindy's mom was losing her own ability to problem solve and organize herself, even though she prided herself on those two qualities. Cindi says understanding that was really a breakthrough for her.
In my heart, I thought that my mother still had the ability to be logical, that she still was logical, and then I could deal with her logically. And it was a huge step that the program helped me understand that her logic has gone bye-bye.
And how are the two doing now?
Much better. Cindi no longer argues. She set up a new system. With Lauren's help, Cindi created a set of alarms and automatic pill dispensers to help keep her mom on her medication regimen while still letting her take the pills on her own, preserving some of her independence. And it worked for years. Now, recently, her mom moved from her own apartment into a nearby assisted living facility, and there a nurse comes by to help her take her meds. Cindi visits her mom several times a week, and they go on walks. Lauren's been there for Cindi at every turn.
Essentially, she was teaching me how to swim, how to tread water, how not to gulp in the water of my mother's illness and drown.
Cindi attributes her ability to keep her mom out of a nursing home to the help of Lauren and the Eskenazi program.
And that's a key goal of this new federal program for Medicare, right? Keep patients in their homes and out of nursing homes?
Yeah, that is one of the ways Medicare will be measuring if this approach is working. When you consider all the money that the government is spending on dementia care, this year it's going to be $231 billion. That includes hospital visits, drugs, and nursing homes. Medicaid pays for most of the nursing home costs. And that care is so expensive, Dan, that the program actually spends 22 times as much on dementia patients as it does on other patients.
Oh, so that's why the GUIDE program, which again aims to keep patients out of nursing homes, could save taxpayers money.
Right. Now, we don't have a specific number about how much this pilot could save, but at scale, one estimate suggests a program like this could save as much as $21 billion over the next decade. Okay, that's real money. So again, there are nearly 7 million dementia patients. How many will get access, Alex, to Medicare's pilot program that starts this July? Not that many at this point. First of all, the patient has to be eligible, which means they have to have a formal dementia diagnosis. They also need to have traditional Medicare insurance, and that's only about half of people over 65. The others, seniors on a Medicare Advantage plan, they're not eligible. Also, the patient has to be living in their own home or a family member's home, or like Cindy's mom, in an assisted living facility. But bottom line, they cannot be living in a nursing home. And lastly, even if they meet all those criteria, they still have to live near one of the Medicare-approved programs. Medicare expects to announce those locations sometime this summer.
And while this does seem like a small experiment, it's a big deal in that Medicare is taking this step. I mean, lots of people in healthcare tend to follow what Medicare does.
Yeah, that's exactly right. Medicare's Liz Fowler told me that their pilot project is getting other hospitals excited.
Where goes Medicare goes the rest of the country. And we're already hearing from providers who aren't in the model or who weren't accepted into the model saying, well, we're going to be looking at implementing some of these new policies anyway. That's great news because it means an expansion of this approach to care.
Medicare will be analyzing the results of this program over the next 8 years. That's 2032. And they're looking for 3 things: reducing caregiver stress, improving the quality of a patient's life, and keeping people out of nursing homes.
And Alex, what about the money? We've talked about how this could, in theory, save Medicare and Medicaid billions of dollars over the next decade. Will that be how Medicare decides if this whole thing is working?
Well, so Liz said that the statute defines success as improving quality without increasing costs.
In other words, they don't have to necessarily save money. They just want to make sure they're not spending more.
Exactly.
Thank you for your reporting on this, Alex.
You're welcome, Dan.
One thing we know for sure, caregivers like Rosanne are excited to finally get some recognition and support.
I hope it becomes the biggest program in the country because I know it'll help caregivers. Every one of them would benefit from it. Every one of them.
Since her mom died 3 years ago, Rosanne's worked with caregiver support groups and started a podcast on how to help them and their loved ones through dementia. She says while the Medicare program is limited, it's more support than she had or that millions of other caregivers have right now. I'm Dan Gorenstein. This is Tradeoffs.
If you enjoyed today's episode of Tradeoffs, don't keep it to yourself. Tell someone else about it. Friend, colleague, family member. Better still, leave a rating or a review wherever you subscribe to us. The NPR app, Apple Podcasts, Spotify, wherever. The Tradeoffs team is producers Alex Olgin and Ryan Levy, editors Kate Cahan and Deborah Franklin, executive director Jessica Silverman, marketing director Catherine Dougal, audience engagement lead Shannon Crane, with help from Kate Seepy and Kelly Osmondson, sound design by Cedric Wilson and Andrew Perella, executive editor Dan Gorenstein, and senior producer Leslie Walker. The Tradeoffs theme song was composed by Ty Sitterman, with additional music this episode from Blue Dot Sessions and Epidemic Sound. Tradeoffs coverage of Medicare sustainability is supported in part by Arnold Ventures. Additional thanks to David Rubin, Ann Tumlinson, Jane Washburn, Ronnie Snyder, Gary Epstein-Lubo, David Bass, Jason Resendez, and Sam Fazio. Thanks also to all our listeners who helped to support our work, including Bob Stryker, Katie Haynes, and Will Haar. Our media partner is Side Effects Public Media, based at WFYI. Tradeoffs is supported by the Robert Wood Johnson Foundation, Arnold Ventures, the Gordon and Betty Moore Foundation, the Sozoze Foundation, Just Trust, West Health, the California Healthcare Foundation, the Leonard Davis Institute at the University of Pennsylvania, and the National Institute for Healthcare Management Foundation. Our financial supporters are not involved in any decisions about our journalism. The views expressed in this episode are those of the individuals and not those of Tradeoffs staff, advisors, or funders.
Hey everyone, it's Jess and Jen from the beauty podcast Fat Mascara.
So I got introduced to Sol de Janeiro years ago when I tried their iconic Brazilian Bum Bum Cream. My first thought was, this feels amazing and it's super moisturizing, but then my second thought was, this smells so good, it should be a perfume.
Fast forward to now, and Sol de Janeiro has a whole line of perfume mists, including Cheirosa 62, that same iconic gourmand scent with notes of vanilla and pistachio.
It smells like summertime, and all the perfume mists are refreshing and light, so they're perfect for the hot weather.
Shop now at soldejaneiro.com and use the code MASCARA10 for 10% off and free shipping on your first order at soldejaneiro.com.